Hey, DNA. Kate Wilson here with another episode of All Access DNA. Do our genes impact our diet? Can we change our lifestyle to match our genomic profile? We talked to Natalie Samson, a genetic counselor who is certified in integrative and functional nutrition, to find out what is possible with nutrigenetics and functional health. She shares with us information on the impacts of nutrigenomics, how to evaluate testing labs, and the integration of lifestyle genetics into traditional medical care. Let's get started. Thank you so much for being on the show today, Natalie.
I'm so excited to be here. Thanks for having me.
And I appreciate you talking about an area that I don't think, I'm sure it existed, but was not on the main radar when I was in school decades ago, now I can say. So we're going to talk about nutrigenomics and functional health. So first off, can you tell us what nutrigenomics is and how it relates to functional health?
Definitely. Yeah. So I think a lot of people think that nutrigenomics is about looking at single genes and having those tell you what diet or supplements to take based on those single genes. But it actually doesn't work like that. It's very different than, how genetic counselors and the genetic testing, like diagnostic testing that we focus on, where we can often look at single genes. And so the world of nutrigenomics, I think there's a lot of misconceptions and there's so many tests out there. But really, when we're looking at when we're looking at nutrigenomics, we want to actually look at how multiple genes are interacting together within biological pathways. So it's almost similar, if anyone has heard of polygenic risk scoring. It's somewhat similar, but not quite the same. But when we look at multiple genes within pathways, we can kind of assess if there's a predisposition for something. So for example, with nutrigenomics, one of the pathways we look at is the inflammatory pathway. And so in the inflammatory pathway, there are many genes involved. And so someone might have variants that predisposes them to be in chronic inflammation or just have sensitivities to inflammatory triggers. And when we understand that whole pathway basically score, we can kind of assess, okay, do we want to include more anti-inflammatory foods in their diet? And other things that we can consider remove inflammatory triggers. So that's just one pathway. But I think that's a common misconception is we're not looking at single genes. We're looking at genes and how they work together. And the other thing is that my training with nutrigenomics, I've found that I don't really love the word nutrigenomics or nutrigenetics,
Okay.
because we're looking at so many different biochemical pathways in the body, and it expands beyond just nutrition. And, I think nutrient absorption and nutrition is only one small piece of it. So oftentimes when I describe it to patients, I'll say something like lifestyle genomics, but I don't think there's actually a very good term for it yet, since it's, I think relatively new in the genetic world.
Hmm.
And so, describing it in a little bit of a different way. But I love to use nutrigenomics and genetic data or lifestyle genomics data for patients, and how it relates back to functional health, in my opinion, is because functional health is really the idea of looking for the root cause. And
Right.
so if someone comes to us, with various symptoms, sometimes this genetic testing can be really beneficial to identify the root cause. And the second piece is personalization, which I'm sure we'll get into. But I think those pieces really help bridge it back to kind of the world of functional health.
Well, and that's very helpful because I feel like functional health is almost become sort of like a buzzword or incites spiciness probably on different sides in terms of, is this a real medical thing? Is it not real? And so that helps to understand. And so functional health, I mean, is it more functional health genomics? Like we're trying to look at different signatures or gene signatures, combinations of things to help inform treatment or diet, lifestyle, like again, to kind of pull it in more holistically rather than, like you said, focusing on a single gene. Whereas that, an example of that might be like a BRCA or a BRCA gene. We test a mutation, we know it's there or it's not. And then we know that it's a significant increase for these certain cancers. So here are the steps we take. In functional health and functional health genetics, it's more let's look at the combo of this, but then also relate it back to what's going on with this person.
Exactly. That's such a big piece too, is I always say that we want to make sure we look at this information in context with not only, personal health, but that's where I think genetic counselors play such an essential role as well, where we can put on our genetic counseling hat and look at it in terms of personal and family history. And then that's also what we love to do in our practice is really just emphasize working with a team to make sure, we're able to look at other markers as well that providers have helped patients understand, such as like blood markers. And so really putting it in context is key. And sometimes, like you mentioned, sometimes in order to explain the difference between the tests, I will use the concept of penetrance, which is a very genetic term. So the way I describe it to my patients is that some genes are really impactful in our bodies, or those changes in those genes are very impactful. So there's kind of like the spectrum. And so, if an individual is born with, what we call a mutation or a variant in a gene in and that change is very impactful, that gene's very impactful, that can give a diagnosis of a genetic condition, right? Like
Hmm.
Huntington's disease, for example. And then we have kind of this spectrum, right? BRCA and it is an example of, someone might have a mutation which increases their risk. It's a pretty significant increased risk, but it's not 100%. And so when we're doing nutrigenomic and genetic testing, we're looking at the other end of the spectrum of very low penetrance genes, where that's why it's really important not to look at them individually and then assume there's a diagnosis. That's why it's helpful to look at them together because yeah, low penetrance basically means like if you have a change or a SNP, single nucleotide polymorphism, which is just, a small change in a gene on that side of the spectrum, it does not mean you have a diagnosis or that we want to do more clinical recommendations, such as screening surgeries and pharmaceuticals. We won't do that for nutrigenomic genes. So that's where we get more information to support the patient in more of a diet and lifestyle perspective versus more of and we can talk about that more, but that's why I think combining them can be so
Yeah.
helpful sometimes too.
Yeah. Tell us more about how the genes actually influence the way we respond to like foods or supplements or diets. Like you mentioned pathways and you use the example of the inflammation pathway. How else do genes impact the way we respond to the things that we're putting into our body?
Definitely. And also there's, the concept of just briefly, there's nutrigenomics and then there's nutrigenetics. And so, they're kind
Okay.
of used interchangeably, but one is basically, how our DNA code influences things that we process and consume. And then the other is how things that come into our body, whether that's diet, exposures, etc., influence our genes. And so there's kind of this working relationship. But in general, when we're doing testing, so yeah, like I mentioned, inflammation is an example. I'll do one example, that's more specific to nutrient processing is we have genes associated with fatty acid metabolism. And so sometimes people have variants in these genes that can impact metabolism and absorption of fatty acids. So for those patients, for example, we might support it with omega 3s or different timing strategies. And so, in terms of the science behind it, we're looking at genes associated with enzyme speed. So, faster or slower enzymes. That could be fatty acid, like I just said, but also folate or alcohol metabolism. But then we're also looking at transport and receptor genes. So, some variants can alter how we absorb or handle certain foods or like for example vitamin D receptors, there can be more or less of an affinity for the D. So do they need to explore, whether they should, consume more or make sure they're getting in their vitamin D? And then we can look at, more cellular pathways. So inflammation being one of those as well. So basically we're looking at nutrition from these biological systems. And that can be really helpful for patients instead of just like following the next diet trend. That's where we
Right.
get kind of with precision.
But it does sound like there's still some of this. Okay, we're seeing this. We've run this test. We're seeing sort of this profile. Let's try changing this or adding this or removing this. But we're not saying this is necessarily like a cure all. but this at least tells us something to try first rather than kind of
Exactly.
having so many choices to start.
Exactly. And that's when there's so much importance with combining this type of testing with blood testing as well, because then we can actually track markers. So sometimes it can be helpful for people to do these tests and then see, oh, maybe I should test for these markers within my blood instead of just going and trying to get a whole different panel. It's kind of complex with how many blood markers we can test for. And so
Mhm.
then that's when we work with providers, and then maybe they test their vitamin D and they are deficient, and then we can help them get in sources, and then we can recheck it. So that's where we can kind of also assess, if things are really helping or working. But like you said, it's definitely, we're never saying that we're curing anything with this information. It's more, how can we personalize those things?
Right, right. Which is, I mean, I think where we wanted to get with a lot of genetics is figuring out how do we tailor the intervention or the management to the patient. You mentioned kind of not necessarily like being nutrigenetics, but also like lifestyle genetics. So, how does genes, nutrition, how does that influence, or maybe lifestyle factors, or just how does lifestyle influence the genes and nutrition? I mean, back and
Yeah.
forth. So, like things
Yeah.
like stress, sleep, exercise, like how do you pull all of that together?
Yeah. So going back to, let's say someone has a heightened inflammatory genetic profile or pathway, examples of how, things that can influence that is if the person's under chronic stress, if they're eating potentially a lot of sugar, if they're exposed to things that are just inflammatory in nature, then that might impact them even more than someone else in terms of inflammation. And so, that's an example of kind of how other things can influence, what we're seeing in the report. Another really helpful, I think, example is the HLA genes when it comes to celiac. And so for example, we do test for these genes in these reports. And so if someone scores high risk for celiac, it doesn't mean actually that they have 100% chance of having celiac. It's, again, not a diagnosis, but it does increase the chances. And so for those people, the more gluten they eat, the more chance that they might develop celiac later down the line. So it can actually be really helpful for patients, especially testing, earlier, just, for that information. However, if people don't have the variants, you actually rule out celiac. So it can be
Hmm.
helpful in that sense.
Okay.
But anyways, yeah, one example
Yeah.
of,
Well, no, that's really interesting because so it can't just it can be almost like risk reducing or preventative
mhm,
in that
exactly,
scenario.
totally,
Um,
exactly.
and then I don't know if you have any other examples that would be helpful to share. I mean, you've provided some great ones.
Yeah, yeah, definitely. Gosh, there's so many that we can pull from, but I think the biggest thing too is that, like, I kind of inferred to this earlier, but when we're doing this type of testing, it's actually really helpful to do a bigger panel. And that's, again, the reason is because we're looking at, gene interactions and pathways rather than, kind of looking into specific single genes. And so when we're doing this testing with patients, we actually do want to consider a bigger panel. The other reason is because things work together.
Hmm.
And as you know, as a genetic counselor, one gene can be responsible for other things. It doesn't play just one role. And so, doing kind of these bigger type panels can help us put things into context too. And that's something that I see maybe not happening in this space with direct to consumer testing. For example, I see a lot of patients coming to me with reports of just MTHFR or methylation genes. And assuming that they have a diagnosis or that they should be on a million supplements. And that's not the way we want to interpret or order these tests. So I'm sure we'll talk about this more, but just the importance of kind of doing those bigger panels too.
Right. Well, and I think that brings us to something interesting, which is probably why some folks in the medical community are still skeptical, I would say, is what is the science behind some of these tests and treatments? You know, are there certain parts that have stronger evidence? Are there certain studies that you point to as saying like this helps inform the information that we're giving patients?
Definitely. Yeah. And I think also I do believe that nutrigenomics, especially certain parts of nutrigenomics, has evidence, but I think there's this problem of commercial companies oversimplifying it and putting again too much weight on those single genes. And so there
Hmm.
is a lot of misinformation. I think that kind of when people see it that way, because that's what people most often see,
Right.
there's so many direct to consumer companies out there doing that. It's obviously that piece is frustrating. But yes, I do believe really looking into the science behind certain things. For example, the HLA genes that I talked about with celiac, there is a lot of evidence behind those. There are more evidence for certain genes and pathways than others. The specific lab that we use has a very intense, I don't know what the term is, but process to basically choose which genes are on the panel. So they will look at the research. If there's not enough research where they think this is actionable from more of a lifestyle diet perspective, again, not diagnostic actionable, but if they don't feel like there's enough evidence, they won't put it on the report. So that's also just something that's really important when thinking about labs, because there are labs that put every gene under the sun, even if there's like one small study on it. And so, just I feel like when we kind of look into, pathway driven multi-gene insights, and then practitioners really kind of thinking about how we're interpreting this and avoiding like one gene, one diet claims, or companies that give you 5 supplements for a couple genes in the low penetrant space. I think when we're able to avoid that and really look into the research ourselves and work with really trustworthy labs, I feel like there's a lot of power behind it that we can use. And then it's just also remembering that we're interpreting these reports completely different than when we're interpreting diagnostic testing. So just also switching that mindset. So, going into it knowing that this isn't, going to give us diagnostic information, or might not even give us information for, more conventional treatments, because we're looking at it in a different perspective.
Right, right. It's through a different lens. And I wonder, are
Mhm.
there red flags, or things that red flags or green flags, I suppose, that people should look for in genetic testing companies? Because I know, like in my social media feed, I'm inundated with all types of testing options. Also, it's my algorithm. That's what I look at. But sometimes it can be really hard, even for somebody like myself who has a background in genetics with some of the
Yeah,
marketing. So, is there
totally.
things to look for or look out for?
Totally. So, yes, and it's really hard when the marketing, sales like really it's very hard to kind of piece apart, what's reliable versus not. So, even as someone who has like training in it now, I'll still look at tests and it'll take me some time to really evaluate the accuracy and reliability. But I think one of the biggest red flags I would say is if a company is just kind of marketing as testing for even just like 1 to 5 genes, and then saying they have their own supplements that come with it. Um, I think there's many concerns about that for different reasons. But, something I see all the time is just MTHFR and the methylation genes. So, in terms of methylation, in nutrigenomics, we can look at methylation as a biochemical pathway. One, it's not the only thing we want to look at, though. And then two, we need to look at all the genes in the pathway, not just 1 or 5 even. There's, around 20 that we look at in the test we use. And again, we want to put it into context and not just order it on its own. Methylation can be helpful to understand things like processing of B12, folate, and choline, but we're not going to use it as information on all these different things. As a
Right.
genetic counselor, there was a lot of early research with MTHFR that we've now understood with new research that it's more common than we had thought, and it's not related to all these different symptoms like we had thought or diagnoses. So yeah, I think when these tests offer kind of small genes and then they treat them like weighted single genes, and then they're giving, kind of diagnostic criteria, or they're selling their own supplements, I think just, taking a step back, looking into that. I really also would emphasize, again, I'm saying this so many times, but using a test that is pathway based, which there are not a lot out there. So happy to chat with anyone if they want to explore what's out there. But again, kind of.
And you mean like a molecular or biochemical type of pathway, right? So the genes that they're testing are part of this pathway. So it's not just like we're looking at a gene from one pathway, a gene from another, a gene from another. Like it makes sense, the panel of genes that we're looking at.
Exactly, yeah, and how they're grouped and related together and in more of like a
Hmm.
systems approach. Yeah, exactly, like
Got
you're
it.
saying.
Got
And
it.
the other thing too is I just have to mention how important it is to have qualified practitioners interpret these results. I think that genetic counselors, when furthering training in it can be really, really helpful to be in this space to help with avoiding misconceptions. Because I have a lot of patients who have had results interpreted by someone that maybe didn't know anything about genetics. And so it's even more confusing for the provider and the patient. So, and then I also, there are also, I found dietitians that have a lot of training in nutrigenomics. So just really finding like a qualified practitioner. And then the last thing I'll say too is just as genetic counselors, we always talk about the importance of understanding just your privacy, where is data stored, who can access it, understanding laws like GINA stands for Genetic Information Non-Discrimination Act. And, in the end, these tests do have health, these tests have health information. Some of the tests have ApoE, for example, which is a gene related to Alzheimer's risk. And so, I still believe that we should be ordering these tests under that like with HIPAA compliant medical practices and just having the conversation with patients before they order them on some of, what is and isn't protected in these tests, which unfortunately I think because the testing world has blown up, which
Yeah.
is amazing in some ways, but I think it also has stepped away from that privacy and protection. So just I think it's so helpful to talk with a genetic counselor or a qualified practitioner before ordering the test, even if you're okay with, all the things that, with privacy, I think it's still helpful to just be informed.
Right, right. Well, and I think that brings up some things to look for. Is just sort of like the content of the test. Does it make sense? And you might need additional expert help to kind of go through all of that. And then, like you said, are they selling additional things? Is there something else, going on? And then the data and privacy is, I think, a huge issue, which we've seen come up before in some of these companies. How do folks find a provider like yourself or like some other ones, like you mentioned, some dietitians? Like, I don't know if there's like a central repository where people can go and find somebody in their area. How would somebody even start that?
Totally. Yeah, that's a good question. So I would say if you can just do your research on if the practitioner has any like formal genetics background or training. That's one step. It's hard because there are practitioners, across the US. So when we're referring to it's sometimes in a totally different state. So if you are, finding a provider near you, just seeing, do they actually have genetics background or any genetics training? And then I also think there is a resource that we can potentially share as well called 3x4 practitioner platform, I believe. I
Okay.
can get the exact link.
Yeah, we can put it in the show notes.
Yeah, perfect. So my personal training has been under a woman who has, I think, really dominated the nutrigenomics space in a good way. Her name is Yale Jaffe, and so she created a platform and
Hmm.
a course for practitioners. And so it's really helpful to potentially look into that resource too, because they do list practitioners across the U.S.
Okay, perfect. Yeah, we'll get that and we'll put that in the show notes as well. One thing as we're talking about like the genetic testing itself, is there a cost associated with it? Is it covered by insurance? Especially if they're ordering it directly and it's not through a physician order, my guess is no, it's not covered by insurance, but is there any ever case where it would be?
Good question. So, not as of right now, as far as I know. Usually, high quality panels can sit anywhere from $300 to $500. And then, obviously, with professional interpretation being a separate investment. And yeah, I think potentially there's a future where insurance might cover this type of testing, but as of right now, we don't actually submit it to insurance. That's the other thing too. I just wanted to mention that you can you should be able to get a high quality panel within that range. So just another red flag I didn't mention before.
Right.
You shouldn't really be having to pay thousands of dollars, which I've seen before with the test.
Wow.
just, yeah, keeping that in mind too.
Mhm. I said that's also good to know. So, I'm guessing if somebody were to come in and work with somebody like yourself who's an expert in this space, that would be part of the conversation, though, is the cost of the testing if it's not something they've already had done.
Exactly.
Okay. One of the things I was curious about is talking about weight loss because I think that's one of the ones too that we see a lot, or I see a lot of my advertising. Is genetic testing for weight loss, but a lot of those sometimes are tied into like right the supplements or maybe that they're trying to sell. Is there a link between weight and nutrigenomics?
Good question. So I believe that weight loss is probably one of the most like multifactorial and very much influenced by surrounding pathways. So it's just something like I keep in mind when interpreting this with patients. However, some pathways can be helpful, such as we do have genes. The doctor that I trained under that I mentioned earlier, her
Mhm.
PhD was actually in genes related to the feeling of being satisfied with food and hunger. So, like, such as leptin genes. And so, there are some gene variants that we can look at, as well as insulin and glucose response, which can be really helpful too if someone is very prone to high highs and low lows when it comes to blood sugar spikes and drops can be very helpful for us to understand, do we need to help them with protein and fiber to make sure they're stabilizing their blood sugar more. So, it's there are certain genes, and I also believe that when it comes to weight loss genetics, that is one of the pathways that is especially important to take into context and look at other pieces that could be going on as well, such as, your stress, your habits,
Right, like you
your
said, it's
sleep.
multifactorial, there's so many things at play, so
Yeah.
sometimes it can be
Ex-
hard to just and there's probably not one cause, so I was like, it'd be hard to tease out one
exactly.
cause, but it probably is more
Yeah.
than one thing that's contributing.
Exactly. Yeah. So this type of testing can help us narrow down on what we want to potentially focus on.
Hmm,
But
okay.
I do think working, in a holistic manner. And I think sometimes there are genes also, like you had kind of mentioned, like there are some genes that don't seem to be relating to weight, but can contribute. Like if someone has a high predisposition for celiac and they've never been tested for celiac, I've had patients that go get testing and they're positive, and then they find out they're celiac, and that actually helps them so much because they were eating, they felt bloated and really uncomfortable, and they were keeping on weight just because they didn't know how to eat and it was painful. So,
Right.
sometimes we find things. Another example is we do test for genes associated with processing of something like histamine, which actually sometimes histamine can be produced in the gut, and individuals who have variants in DAO and HNMT in that pathway have a tough time handling that, and they're eating a bunch of fermented foods because they're trying to be better, but that's actually not helpful for them. So it's, sometimes it's kind of, yeah, just really looking at the holistic picture too, like you're mentioning within the genes as well.
That's helpful too, because it could like you said, people could be eating something that they perceive as healthy or good for them, but it's actually going against some of the genomic signatures or the profiles that they have and is making them feel worse.
Exactly. Yeah, we actually have that a lot where someone another example is someone maybe has high, oxidative stress and histamine combined, and they're doing really long sauna sessions. And sauna is amazing. I do love sauna, but for those people, it's
Mhm.
actually really not it's not helping them, get out of that kind of more reactive state. So, yeah, there's so many examples too where we'll find people are kind of hopping on every wellness trend, and we're like, well, actually that might not be best for your body. Keto is an example too. People
Right.
consuming really high fat diets, really high saturated fat diets, they might have, a higher chance for having issues with cholesterol and fat breakdown. So it's yeah, there's a lot of those that come up.
Yeah. No, and that's very helpful because I think that was one of the questions I even had for you or was thinking of because it's sort of like, what is this type of testing, or assessment going to give me beyond have a healthy diet, right? And it sounds like, well, it can provide this additional layer of information beyond just, eat a balanced diet or whatever the trend is these days. It's hard to
Exactly.
tell
Yeah.
now what a
I
healthy diet
know.
is.
Yeah, we have paleo, keto, oh my god, vegan, veg yeah,
Yeah.
exactly like you said, I think that's really where it can be powerful when people also come in and they're like, "I'm doing everything and I feel terrible." And that's, I feel like, how it also relates back to functional health and how we can kind of apply it.
Mhm. One question I also had is in thinking about coming at it from, again, as being a genetic counselor and looking at single gene diseases, things that have high risk. There's this not wanting to test kiddos for like adult onset diseases. Now, of course, there's some of these conditions show up in minors and in pediatrics. How does this work with nutrigenomics or with functional genomics? Do you test children? Do we know that this is something that, because again, it's thinking about lifestyle, is this something that could impact kids? So if a parent is worried about their kid, and some of these types of things, how does that work?
Definitely. Totally. Yeah, so I definitely think we can, but we also have to be careful in what we test for. And so again, that's why I think so helpful to have a kind of an expert helping support the pre-test part too. But for example, if we're testing a child for predisposition for celiac, that can be helpful, and that, because it's not, it's not like a disease, adult onset type of relationship, it can be helpful. However, like I mentioned, some of these reports have genes that can relate to adult onset conditions such as ApoE with Alzheimer's. And so that's something we do in our practice is, if we are considering testing children, we will actually talk with the parents about removing those genes off the report or not testing for them, to make sure that the person is 18 and has the autonomy to choose if they want to know that information. So that's where kind of, I think, pre-test counseling becomes essential. And then always making sure that we pair guidance with we pair it with pediatric guidance as well. And again, work with the provider to make sure, a lot of these labs won't, if they do give recommendations, they won't cater it to younger populations. So we have to really make sure we're like hands on with that, with whoever the legal guardian is or the parent, so we can appropriately interpret and everything.
Right, right. I think that's a huge concern I hadn't thought about is I wasn't even aware that some of the genes were like ApoE or some of the things associated with that. So yeah, thinking about testing kids for that and they don't know that that's part of the port. I mean, even there's a challenge too with adults getting this information that they were not anticipating. Um,
Exactly.
and I like what you said, like it does make sense that there are some benefits that kids could have from knowing this information, like use the celiac example. But like you said, the labs themselves, I don't think I've really seen any direct to consumer ones that have a report based on someone's age, right? Or
Yeah,
based on,
exactly.
no personalized reporting, as it were.
Exactly, which is, yeah, that's something that is really frustrating for us as providers, because I will actually tell patients, don't look at the recommendations the lab gave, because they're not, it's funny because they're not actually personalized, because, even though they are taking into account the DNA variants, they're not taking account into, they're not taking into account age, psychosocial factors as well, personal and family history, all
Right.
these factors, like you said. Yeah. So it's, and sometimes, I have patients who potentially have a past of, disordered eating, or, some, potentially an eating disorder. And then the results are kind of putting them on this very restrictive
Mm,
diet. There's just
right.
examples where that's why I think working, with providers, again, so helpful.
Yeah, and I would say it does open up this whole other discussion about like what do we mean when we're talking about personalized medicine, right? Is it
Yeah.
personalized to your DNA, but does it make sense with all these other things that we know about you as the person?
Exactly. Exactly. Yeah. I think that's so important in the world of personalized medicine, to have that human aspect. Another reason why, I have patients who will say, I put my report into AI, and I'm like, well, actually, it's not very helpful for many reasons, but also just a big one being like, AI has no idea any of the context behind anything for you personally. And then also, of course, potential for inaccuracy. But yeah, definitely.
Right. One thing too that I think we're seeing on, I guess I would say like the diagnostic side is as we know more, do more with genomic technology, we find things, that we wouldn't have found 15, 20 years ago. So we're starting to see some folks come in for like updated testing. Do you see the same thing going on in nutrigenomics and like functional health that people should repeat the testing at different times?
100%. Yeah. So very similar to more of the medical diagnostic space. Research is evolving all the time in this space very quickly. And the genetic testing lab we mainly use will look into it and look into updates. And so they just had an update this year, and it had been 4 years since they updated it to include genes that have enough evidence to be on the report. So I think as research evolves and also potentially life circumstance changes as well, it can be helpful to look back into potentially update testing. Just as a reminder to everyone, our DNA code doesn't actually change. So when we are looking at these specific variants, it's not necessarily that those variants would have changed for you, but what could have changed is we discover new genes or we have new technology to look at that specific gene or find a new variant within that gene. So, I just say that because I have had patients that say, well, in 5 years, will this report change for me? Like, because I'm doing different things. And that's when we're kind of talking about epigenetics. We're not talking about the DNA code you're born with. So,
Right. And that's something we've talked about in some other episodes too, when we're talking about some of these like multifactorial conditions, chronic conditions, is thinking about, okay, so it may not be the DNA code you were born with, but as we get older, we call them like somatic mutations or things that are in our body cells, like we can acquire changes. And the example I always use is like somebody who had a bunch of really bad sunburns as a kiddo, gets skin cancer when they're older because, it damaged that DNA that was in those body cells. But it probably didn't necessarily impact what was in like the sperm or the egg cells, right? The ones that get passed along. So
mhm.
is that another thing that you see happening with nutrigenomics coming down, is looking at some more of these like acquired changes over your lifetime or the epigenetics?
Yeah, I think that's such an interesting space. I will say right now, from my perspective, with the science and technology we have, it's still tricky to look at the somatic changes. I mean, with kind of a grain of course, we have somatic testing when it comes to cancer. I think that's a little bit different than looking at, how, for example, like inflammatory genes, how those are being expressed. I think we're not there with the technology yet to look at like real time expression data quite yet. Yeah, like you said, I think potentially we're moving towards that. And also, it can be helpful to kind of look at other markers that may be showing us data in that sense, such as like again blood markers, and if there's changes happening.
And so looking ahead, like where do you hope to see nutrigenomics? Where do you hope to see functional health and kind of bringing it into mainstream, I would say, medical care or healthcare?
Yeah, my hope is definitely that we're able to bring it into the healthcare space and have it exit, the more direct to consumer space. I think that it can be, I do think that there are like benefits with, having these tests more widely available in terms of more knowledge of genetics and things like that. But I do think it's so important to really treat these tests, as pieces of healthcare and like really have expert interpretation in that sense and just view it and kind of healthcare providers being able to view it as you know, uh, in a different lens and being able to kind of speak it more fluently or interpret it in that sense. But I do feel like as research continues and hopefully that transition occurs, then I do think it can be a tool that can really be helpful with, you know, proactive and personalized and like participatory medicine so that we can really, support patients in just many different aspects by using the amazing technology that we have to look at their DNA from different perspectives. And the last thing I'll say too is that I really hope for the future that the spaces are less siloed because I do have patients coming in who maybe a provider, a functional provider, ordered this type of testing, but didn't look at potentially, they didn't refer to a genetic counselor or look at other genetic tests that may be helpful. And then obviously, of course, like how can we combine these? So, in our practice, we're always really making sure we look at, the whole picture again, family history. Oftentimes I will have patients who maybe didn't even think about other tests. And when we talk to them about it, they're surprised it was never brought up to them, and can be really helpful, like hereditary cancer testing, for example. So I
Right.
think
Yeah. Cause I'm
there's
thinking of like
room.
somebody that may have had a test because, they're feeling bad or they're just like, something's not right. I don't feel like 100%. But, that's what they're focused on because that's their day to day. But then they have something else potentially going on in the family that is also a concern, like you said, mentioned cancer, like cardiac disease or something. That those in the diagnostic industry would be like, well, we should also think about that. So I love that you talk about bringing kind of those two pieces together.
Yeah, exactly. Yeah, thank you. I think that's so important. We've had a lot of patients where when we do their pedigree and we educate them on, that space, then we potentially do find a variant, maybe I just had a patient the other week who she was like, I don't someone told me about BRCA testing. I never did it. My mom did pass away at a young age from breast cancer, et cetera. So
Uh-huh.
we talk about cancer testing. We've had patients come back positive and they're so grateful because they didn't even think about that on the radar, but now they're able to be proactive and use that information as well. So yeah, like you said, I think combining medical and more diagnostic testing with this world, I think is key too. So we're not, especially in this world, we're not missing that huge important piece that us genetic counselors are really well versed in.
Definitely. So before we wrap up, I did want to ask, is there a place that we should send folks to find you if they have additional questions or they want to learn more about the services you provide?
Definitely. Yeah. So our website is www.goldengeneticshealth.com. And I'm always open to chat as well. So if you want to email me directly, my inbox is open. It's Natalie at goldengeneticshealth.com.
Right. Thank you so much for being open and for sharing even the email. So we'll definitely put the info in the show notes. And then Natalie, I've just really enjoyed this conversation. I have learned a ton within the last 45 minutes. So just appreciate you being here today.
Oh, thank you so much for having me. Really appreciate it.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all the episodes of the show. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Please rate and review the podcast on Apple, Spotify, YouTube, or wherever you listen. This helps other people like you discover the show. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. All Access DNA is an independent podcast hosted and produced by me, Kate Wilson. Designs by NKJ created the logo. Thanks for listening and join us next time.